Hello, my name is Syed Abbas Ali. I am one of the myeloma faculty at Johns Hopkins. I primarily do immunotherapies, including CAR T-cell therapies and vaccine trials for myeloma. And I wanted to talk a little bit today about an exciting upcoming vaccine trial that we have. It's called a GVAX vaccine. These have been studied at Johns Hopkins before and basically involve using cell lines for different cancers in combination with a cell line that produces GM-CSF that makes the immune response more robust. And a trial done previously by my colleague, Dr. Ivan Borello, involved using GVAX vaccine in combination with Revlimid, which was not a randomized trial, but had a component of patients that did not receive the vaccine and a component of patients that did receive the vaccine. And we saw some really excellent results there for people that did not have a very aggressive myeloma, but did have maybe a little bit of residual myeloma, or what we call a near complete remission or a complete remission. And what we saw was that people that did receive the vaccine seemed to go longer without their myeloma recurring versus people that didn't get the vaccine. So what we thought we might do is perhaps have a larger trial, a phase 2 study, which we have now opened, which will be accruing very soon. This will involve a randomized double-blind placebo-controlled trial with one arm of patients receiving a GVAX vaccine, also in combination with Prevnar vaccine, in combination with Revlimid. And the Prevnar is there because we used it in the earlier trial, but essentially this will be GVAX vaccine and with arms that don't include GVAX. And actually 2 out of 3 arms will include GVAX. One arm will be randomized, blinded, placebo-controlled, which will not receive GVAX. What we hope to see is, especially for people who have myeloma that is not rapidly progressive but want to prevent relapse, who have a good control of their myeloma, that by giving the vaccine, which so far evidence has told us is very non-toxic, easy to give, easy to use, will help give them a longer progression-free survival and keep their myeloma under control for longer. We expect that perhaps we will push patients who are MRD positive and maybe make them MRD negative. And even for those patients who may be MRD positive and remain that way, we expect that giving the vaccination will allow the immune system to control the myeloma a little bit better, and expect that the patients will do better without their myeloma progressing. Patients who are currently in remission can absolutely participate. You can be in a complete remission, however, you must be MRD positive to participate. Patients who are in a complete remission but not MRD positive, meaning they are MRD negative, are in a good situation, absolutely, but are not eligible to participate. For enrollment on this trial, because we want to study the effects of suppressing the myeloma by the vaccine in combination with Revlimid, having some evidence of myeloma, at least MRD positivity, is enough, but not too much myeloma, because we need reasonably good control. The vaccines aren't meant to treat like some of the bigger drugs. They're meant to prevent people from relapsing. So a good question might be was that how do we combine the Revlimid with the vaccine, the GVAX myeloma vaccine? And the thing is that what Revlimid does, and we don't have to use Revlimid at full doses, we can use lower maintenance doses, but what the Revlimid does is we think it modifies the immune system. In fact, it's an immunomodulatory agent. It modifies the immune system and makes it more sensitive, helps it mount a response to the vaccine. This is why Revlimid is very crucial in making sure that the immune system is able to recognize and build a response to the vaccine. However, Revlimid can be at lower doses and does not have to be at full doses, and these are very manageable. For people already on Revlimid, this is easy, fairly simple enough. For people who are not on Revlimid right now but have previously been treated with Revlimid, they are also eligible to go on. Another question might be, people might ask, well, what if I've had a transplant? If you've had an autologous stem cell transplant, you are eligible, but we encourage people to wait for a year after the transplant before they can come onto the trial. The reason for that is that transplant changes the immune environment and we want everything to settle down before we put them onto the vaccine trial. So if you have not had a transplant and your myeloma is in near complete remission or complete remission, good control but MRD positive, then you're eligible for the trial. And if you have had a transplant, then as long as you're more than 12 months out from the transplant and your myeloma is either in complete remission or near complete remission, i.e. good control, but MRD positive, then you're eligible for the trial. So a question might be asked that what if I've had a transplant a long time ago? and but my myeloma is under good control according to the criteria for the trial. Can I participate in this trial? Absolutely, you can participate. There are, as with every trial, some basic criteria for getting on there. Have to be in reasonably good shape and so on. These are not particularly stringent because, again, these are designed for, as we know, myeloma patients tend to be a little bit older, and the vaccine so far has been non-toxic, and we don't want to make people sicker. This is essentially to help people get better control of their myeloma who already have a reasonable control but know that most myeloma will relapse at some point in time. So yes, if you've had a transplant remotely, then you are still eligible so long as you meet the other criteria. So a question may be asked is, how is the vaccine administered and what is the sort of timeline for the being on the trial? So once people are screened, the vaccine is administered on a monthly basis for about 3 months, and then you get a vaccine booster 6 months after you started the trial, and then you get a vaccine booster 1 year after you started the trial, and then you get a vaccine booster 1 year after that, and another vaccine booster 1 year after that. So the total duration of vaccine treatment is about 36 months. The last 2 of those doses are booster doses, and the 4 doses in the first 6 months are the initial vaccine doses. Now, the vaccine is administered, there are 3 shots per vaccine, so it's like going into your doctors and getting, for instance, if you were to get a tetanus or a measles, mumps and rubella virus, those include more than 1 shot. Typically, it would be something very similar. Again, these are reasonably well tolerated. They don't, people do complain with other vaccines, for instance. I certainly do when I get influenza vaccine that I ache, but that's not really been reported all that much with this at all. Aside from a little bit of redness and occasional soreness, people really haven't complained of too much. In the prior study, we didn't see any major side effects at all. So we think that this is a very nice, tolerable treatment that may help keep people's myeloma away for longer. There are the screening process does involve a bone marrow biopsy, and there are bone marrow biopsies not very frequent at regular intervals on an annual basis and at 6 months. This helps us determine how people are doing with respect to being, if they've moved from being an MRD positive state to an MRD negative state. And remember, even if they are MRD positive, they may well have a longer progression-free survival, we call it, which is what we saw with the original trial as well. A question that might be asked is that, will being on this vaccine preclude me from doing other immunotherapies if I come off the trial or if I need to go on to other immunotherapies? As far as I'm aware, there is no other immunotherapy that is prevented from people pursuing this vaccine. Every immunotherapy trial is different and they may have different requirements. I would suspect that the most stringent requirements, if you've had a prior vaccine, is if you try to go on to another vaccine trial, and then they may have questions about that. But patients may ask whether they can proceed to CAR T-cell therapy after they have been on this sort of trial, and I do not foresee any sort of barrier to going on to CAR T-cell therapy or other related therapy if they have been on this sort of trial.